Hey guys, Stacy from Easy Acupuncture School. This is part 3 of the 10 questions. I'm Stacy Hewitt. I'm your moderator for today, your host of hostess. Um, I'm Stacy Hewitt. Been practicing for 13 years, been teaching for 7, and let's get started. I'm going to go over a couple of things that I covered yesterday because I feel like I didn't do them clearly or I stumbled through them a little bit. So I'm going to get you guys back to the presentation and we're going to review a couple of things real quick and then we're going to finish this up today. So let's see here. Oh, let me hold on. Let me share my screen first. And that's not the one that we need. Hold on. Let me try that again. I don't think it's sharing the right screen. It's a different 10 questions. There we go. Sorry. Share. That was another lecture I have for you guys that I'm really excited about, but that's not for right now. Current slide. Um, so let me get this out of the way too. Photo screen. There we go. So one of the things we talked about real quick was that looking at the thorax. There we go. Thorax and abdomen. When you're asking questions about that, make sure if they're having any thoracic discomfort, there's not an underlying Western medical condition. I know we're acupuncturists, but sometimes Western medicine, we need to find out if there's something going on physically. But just because they have physical symptoms, there are some Chinese energetic reasons why this could happen. If there's not any physical Western diagnoses, or like I was saying yesterday, if they have their liver swollen out to here, they need to go see a doctor. But some of the things, for example, that could be energetically based that would not be a Western medical diagnosis, or the Western med doctors might even say we don't know. But like I said, a big one is that hypochondrial region underneath the rib cage on either side. Doesn't have to be just on the liver side, but that hypochondrial region, that is something that will pop up sometime with not spleen, I'm sorry, liver qi stagnation. It's not everybody's going to have it, but you will see it. You will see it. So it's common enough to mention. So I just wanted to cover that because I felt like I stumbled through that a little bit. And then we're going to fast forward to where we were yesterday. Yeah, right here. This is the same thing. Um, in essence, it's like, do you have any heart or lung concerns? When you're talking to patients, make sure that they don't have any Western medical diagnoses, because that can help you. You can translate that into Chinese medicine and then help further along whatever treatments they're receiving. Asthma is important to know about, exercise induced, or is it a lung qi thing? Usually, exercise induced asthma is breathing in. Do you have problems inhaling, or do you have problems trying to blow out the candle like in the old Primatine mist uh, asthma spray commercials that you used to see on TV? So if it's pulling, breathing in, then you think about lungs grasping the chi. That's why I'm making these pull down motions, as opposed to blowing out, which is more of a lung chi issue. It's also good to know if their heart skipping a beat. Do they, or have they had an ablation? Are they in the process of signing up for getting an heart ablation done? Those things are important to know. But just like that last slide that we were looking at, it's sometimes some of these issues can also be caused by emotional energetics. So ask them about their stress level. Are they under any kind of high stress or emotional duress? That can cause heart palpitations as well. Also, are they easily startled? That could be that's timidity, gallbladder, or do they sigh a lot? That's the liver. That's things with the lungs, shallow breathing. It could be chi deficiency, or if they don't inhale well, kidney issues. If they don't exhale well, it would be lung chi. So once again, I just wanted to cover that real quick because even though they might not have Western medical diagnoses for something dealing with the lungs or heart, there could be a Chinese medical thing. I mean, there's always going to be a Chinese medical thing behind it. So check that out. But if they're having breathing issues, heart issues, make sure that they've checked themselves out with the doctor because you want to be safe. You want to be responsible. And the more you practice, the more you'll kind of get the feeling of when they really need to go see a doctor or not. But for starting out, make sure that they've gone to see a doctor. How is your digestion? Remember, we're doing how to make this more conversational as opposed to just going down the list prior. How's your digestion? When you ask people, many people think that you're only referring to, you say, hey, how's your digestion? They just think are you asking them about if they have the squirts, if they have diarrhea? And so you want to make sure that you clarify, do you have any issues with bloating? Do you have any issues with gastritis, stomach pain? What's your bowel movements like? We've already talked about bowel movements, but ask them, do you have a daily well-formed bowel movement? You really want to get in there to find out about what's going on with their digestion. Like I said, bloating, gastritis, acid reflux. And here's some things here to look at. Digestive issues could be food allergies. Yes, ask if do you have any allergies to certain foods, and food allergies are a version of spleen chi deficiency. So, but find out because sometimes you can be, bolstering that spleen all you want, but if they have really serious food allergy issues, if they have, darn it, it slipped my mind. Not SIBO, celiac disease. Yeah, it's going to be a hard road to hoe with your little spleen 3, stomach 36. Celiacs, sometimes people do have allergies and it's not going to get cleared up that easily. Not saying that it can't, just saying it might take a little time. Acid reflux. Typically, it's going to be liver attacking the stomach or spleen. Remember several lectures ago when we talked about the depressive heat in the liver and then how it attacks everything, in a lot of different directions. So the stomach and the spleen can be two victims of that. So check that out. Or it could be just rebellious stomach chi. We talked about that where, instead of going down, it's coming up. So think of it that way as well. Bloating. Bloating can be a weak digestive system, spleen chi deficiency, or liver chi stagnation because liver is attacking or attacking the stomach spleen. But more importantly, when you have liver chi stagnation, they talk about that chi gathering up in the abdomen region, so it just starts to collate or coalesce, not collate. That's how what happens on your copying machines, but coalesce in that area. And because the liver's not making the chi run smoothly, it's getting stuck. So, and it's getting stuck in that abdominal area. Belching, rebellious stomach chi, craving for different foods. We talked about that last version number 2 of this. Hopefully at the beginning I said this was number 3. I try to say what version these are now, but anyway, if I didn't, I'm sorry. In version 2 of this lecture, we talked about look at sweet. Do you crave sweets? Do you crave salty? Do you crave bitter? Things of that nature. Look at that. Sour. And then obesity may imply an underlying duress. could be stress related. A lot of times we think, oh, look, there's something going on with the spleen system because there's all this adipose tissue, and adipose tissue is controlled by the extra phlegm caused by a weak spleen, yada yada yada. Yes, that can be true, but then also look at, are there emotional issues behind this, and what's your intake? We've talked about this probably, I think, in the first part of this lecture. But with weight loss, you think about, what's your exercise level like? What's your caloric intake like, too? A lot of people, it's very funny. You start talking to them about that, they're all hell bent on you trying to have the magic point with acupuncture for them to lose weight. And then you start talking to them about the simple facts of, well, or they'll have some kind of crazy exotic diet. And you're like, oh, that's great. But you're still saying that you're having problems with that. We might need to look at you might want to look at maybe getting a little exercise, and maybe really looking at the science behind it and looking at some caloric intake. Oh, no, 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 no. I don't need exercise. I don't need exercise. I watch exercise videos and I just sit on the couch, and I don't exercise is not for me. Okay. And caloric intake, I don't like calorie counting. Well, there's a lot of different ways to, I don't like calorie counting. You'll get that all the time. And then they're like, what points do you have to make me lose weight? And you're like, oh, help me, help me. But anyway, that's the thing right here that I haven't read. Many people ask about acupuncture, if acupuncture helps weight loss. Maybe I haven't given you that little talk yet, but I felt like I hadn't. Um, but let me finish this whole thing with obesity, making sure there's not an emotional piece underlying it, and if there is, and if it's very severe, then make sure that they're seeing a therapist that can help with that as well. Many people, like I said, will ask about, will acupuncture help me lose weight, because they think it's magic. Um, I used to advertise that it would help. I've taken that off my site now. Um, because it is very frustrating where you will try your darndest and you'll do all of your tonifying the spleen, tonifying the stomach, and you're doing your best, moxing their back shoes for 20 and 21. I mean, you're doing your best, and then they don't pull their half. They're not participating in the half of their team a lot of times. They'll say, oh, I'm not working out, or I've been to a buffet every night, or one of the things I remember in the very beginning when I was a very young acupuncturist, or young and experienced, I had two women that came in, and both of them were really wanting to look at weight loss because they felt that they were very active, but they weren't losing weight. So we were doing points and they still weren't losing weight. And one of the issues was this: both of them were menopausal, of the age of being menopausal, perimenopausal. I think they both were starting to go into menopause. And what's very fascinating is when people start going through that change. I also, at the same time, had another patient that was a personal trainer, and she talked to me about how and I wish I had remembered this in detail, but it was like 12 years ago, so it was a long time ago. But she talked to me. I'm starting to do again. I apologize, guys. Put a penny in the jar, so I'll stop. But the personal trainer was telling me how she went to a class on menopausal women, and one of the things that she found out is that really, as your metabolism slows down, it catches people off guard, especially in the beginning, where they're maybe amping up their training, or maybe not really amping up their training. They're training at the same level they've trained for decades. And then suddenly it's not working. And it's because their metabolism is slowing down, because menopause is starting that to occur. And the personal trainer was saying, yeah, it was really interesting how you really had to look at your diet and the caloric intake that you need to take in to maintain your weight level was a lot less than what you were used to taking in. I mean, not saying that you needed to starve yourself. That is not what I'm saying, but it was like maybe 300 or 400 calories less per day than what you were typically used to. So there are physical changes that are going on the patient side where they really, and the personal trainer was saying, yeah, you had to kick up your activity a little bit and drop your caloric intake a little bit. You know, that glass of wine a night that it used to be fine, you might need to cut out because there's too many calories. So there's a lot of science behind that. And a lot of times patients don't want to hear that. That's the end all be all of it. They don't want to hear that. So you need to make sure if you're going to start promoting that your acupuncture does weight loss, that you need to really make sure that your patient participates. It's not that you just coming in and lying on the table and me sticking needles in you are going to make you skinny. You're going to have to work those bones, those muscles out. You're going to have to drop that the some of that stuff that you're consuming. If you like, a couple of ho-hos a day, you're going to have to cut them out. Cut them out anyway. But not it's not about starving yourself. And also, like I said, with situations like this, make sure that people don't have a history of eating issues, because then that can be a whole nother kettle of fish. And if they do currently are in the throes of having eating issues, make sure they're under a therapist's attention. Okay, are you having any problems with urination? So that's the other conversational question. You wake up at night to urinate? And it's okay that, when you're 20, you might not have to wake up at night. But when you get older, you do. And then if they start waking up more than once or twice a night, if they're waking up 9 or 10 times a night, well, not even 9 or 10, 5 or 6 times a night, 4 times a night, you're starting to get on the edge of, well, not even starting. You're really having nocturia, frequent urination at night, and acupuncture can help with that. Think about kidney yang deficiency. Also, think about, especially with women, do you have a chronic urinary tract infection, or do you have a urinary tract infection? Because it's easier for women typically to get urinary tract infections than men, but that could potentially be it. Damp heat, urinary tract infections will make you get up all the time. Also, there could be a potential candida. That's a completely different topic that we're not going into. Men urinary functions. Also, we've talked about this before. Look at the age of your patient. Could there potentially be prostate issues? Because enlarged prostates will make people wake up frequently to urinate at night. So once again, and then also for men, on the rare occasion, they could have some kind of UTI. And especially when people get older in life, really older in life, UTIs can become more prevalent in both males and females, and also can have some other effects that typically us youngins don't see. Meaning, like, I've had a couple of patients, and these are very old patients, but they get UTIs and it starts to affect some of their cognitive abilities. So, and UTIs can be a little more devastating for elderly people than younger people. I mean, with younger people, usually it's just UTI, but there's people that are dying from UTIs, not young people typically. No, I don't want to put the fear God in you, and it's not common, but you do have people that will pass away from UTIs, and just be on the lookout for that. Just be on the lookout for UTI in general. I mean, it's not something that you'll see all the time in the clinic, but if somebody is having a lot of urination, painful urination, or frequent urination, then advise them, if nothing else, go to the drugstore and buy a box of those test strips to see if you have what your leukocyte count is, and to see basically there's urinary tract infection test strips that people can take. But if they do have a UTI and they haven't seen a doctor, tell them you need to go ahead and go see a doctor to get it knocked out. Like I said, that enlarged prostate could start generating some damp heat, which could cause some frequency of urination and also just stagnation in general. Do you have a bowel movement every day? We've already talked about this. We're looking for 1 to 2 bowel movements. Chronic constipation is too much heat in the body, and or their diet is bad. Heat comes from fried foods and alcohol, anger and resentment. Anger and resentment, what is that? That's that whole depressive heat. The liver's heating up, cooking the large intestine, making constipation worse, or a strong drive to succeed, a type A person. That's another thing that the liver that can make the liver heat up. And what that strong drive is separate from the kidneys. The kidneys are involved with motivation, but a strong drive is like the demand, organization, demand. I need to see that TPS report by the end of the day, and I'm just giving it to you now, and it's 11:30. It's that strong A type personality. That's different than motivation. If I'm going to do this, I'm going to survive. That's what the kidneys are about. Chronic loose stools show weak spleen, and or we've talked about that spleen and kidney yang deficiency or kidney functions. Diarrhea first thing in the morning, specifically, that could be the kidney functions with the spleen yang functions. And then if they worry a lot, then that's going to be spleen if that's tied into their diarrhea. I mean, if they worry about in general, that's spleen, but just saying if they emotionally, if they have a lot of loose stools, check to see if they do worry a lot. Alternating constipation and diarrhea reveals high stress. They probably are stressed out. Ask them about their stress. And an overtaxed liver, meaning that liver is going to be attacking the spleen, right? We've already talked about that. And I don't know if you guys can see this slide or the picture of my beautiful face is in the way. What's your menstruation like? Do you have any erectile function concerns? So once again, find out if their menstruation is regular, what their flow is like, do they have any clots. Then, with every man, you don't have to say, hey, do you have any erectile dysfunctions? And typically it's for people later in life. And the other thing about usually I let my patients bring that up if it's a concern of theirs. If it's a concern of theirs, men will bring it up. Needling somebody about that's 80 years old, do you have erectile dysfunction issues? We already know that there's a predilection for that, and we can figure out if they have a kidney yang deficiency outside of asking them if they have erectile dysfunctions. Because I think I've said this in this lecture, maybe it was in the other lecture. No, it's probably the diagnosis lecture, and I'll say it again. I'm about not making my patients feel uncomfortable. Not everybody wants to talk about that. I had a student that got on my case about not asking people about elderly people about their sex life because it was a big, there was all these stories about there's more sex going on in retirement facilities and people aren't talking about it, and people are having what I said last time, UTIs or getting sexual diseases, and there's not enough information because everybody's being shy about it. I'm not a prude. If you want to talk about it, I could talk to you all day long about your sexual dysfunction. I could talk to you all day long about your erectile dysfunction or your low sex drive. I don't have a problem with that. But some people, especially now, if they're in their 80s, it's just their generational thing. They might not be comfortable talking about that. So figure out if your patient is or not. Like I said, I usually, if it's important to them, they'll bring it up. most of the time. Most of the time, you can figure out if they have kidney yang deficiency without asking them about their erectile dysfunctions or their low sex drive. But to each their own. Not saying don't do it. I'm just saying weigh weigh what you feel like your patients how open they are. I don't want to needle a 80-year-old woman about like, oh well, is your vagina dry, and then do you have low sex drive? I mean, I would think probably, but the answer would be yes to both. Don't ever assume anything in Chinese medicine. But if you look at the timeline of things, and especially if they're already having kidney yin deficiency symptoms, then probably both of those things are occurring. And I've already figured out that you have kidney yin deficiency. I don't need to ask you if your vagina is dry because I don't want to embarrass you. I want you to feel comfortable. If you want to talk to me about that, you can. I mean, I had a patient yesterday, and I was just talking about that suddenly popped up that she had all these kidney yin deficiencies, and she was sipping water, and she was like talking about how everything had dried out. I didn't need to ask her if her vagina was dry because I already knew that she had kidney yin deficiencies. Her kidney, there were yin deficiencies, and her body was already globally dry. So I didn't need to ask her that to embarrass her. So anyway, menstrual patterns, like I said, reveal the health of the liver, the kidneys, and the uterus. The liver distributes blood. The kidneys are part of the blood production. I would say also, I would have in here spleen too. Spleen, yes, the spleen is really involved with blood production. Uterus health. I had this young patient recently, and more than likely, well, she didn't come back. More than likely because she probably thought I was not crazy, but she had these really big blood deficiency symptoms. And I try not to talk too much about Chinese medicine with patients, but sometimes I will tell them a little bit about what's going on and try to put it in Western terms as much as I can. And I'll try to explain to her about that because she was not menstruating, and she was in her late 20s to early 30s, and she wasn't on birth control or IUD or anything like that that would inhibit this blood flow. And I'm like, I'm really trying to dig into this. That wasn't her primary concern, and we'll get into that next lecture. But it still was a concern, not her concern, but my concern, because there was a lot of things going on um, down below that were problematic for her. It wasn't necessarily why she came in, but she was bringing them up frequently. And I was talking to her about blood deficiency and what that was about and things. And then she's like, well, and she came back the next time I saw her, she came back and she was like, I just wanted to see my OBGYN, and they didn't have a problem at all with me not menstruating. And I'm like, hmm. Yeah, that wasn't a big deal for them. Really? Because you're menstruating is really, I didn't say this to her. I'm just thinking to myself, it's like, oh, that really speaks a lot about your health. And your OBGYN doesn't give a poop about if you're not menstruating. Well, you can't fight against that. And well, let me tell you what the other reason why she canceled is remember when we talked earlier about pain levels and what's your pain level between 1 to 10, with 0 being the absence and 10 being extreme? She was another person that came in. She had this back pain that I was working with. And the first time I saw her, I tell everybody acupuncture's not magic and I'm going to have to see you a few times. So I saw her one time. And then the second time I saw her, she was like, nothing's changed, nothing's changed. And I'm like, okay, well, and her pain level was about an 8 when I saw her before. And then I'm like, okay, well, on that scale from 1 to 10, what is your pain level today? 0 being the absence of sensation and 10 being off the chart. Well, it's probably about a 3 today. Nothing's changed. And I was like, well, right down here, I've got that it was an 8. And last time I saw you, and then I had to give her the whole talk about acupuncture not being magic. And we really need to look at the parameters of where the pain was and where it is now. And it's okay that if it still exists because it takes a bit, just like going to PT. You can always bring up PT or OT because for some reason people understand, that's a Western medicine tool, and you have to go all the time. So if you bring up PT, people understand it's kind of like PT. You need to come a few times before you get the full results. And between her getting to her and not being magic, and then her OBGYN telling her it doesn't matter if you don't menstruate naturally or not. I think she was like, she probably thought I was crazy and she just stopped coming. So whatever. It happens. So let's get back to what the what this slide was about. Menstruation patterns. We've already talked about that. Men 50 plus, look at prostate health. Difficulty in maintaining erections. It can be either kidney deficiency or it can be liver, because liver, if you can't get it up, you get frustrated, and then you get into the cycle of I get frustrated, and then you can start to worry about it too, I guess. But the big thing is, you think of liver, you think of wood. Not trying to be gross here or facetious, but think of like everybody, the the slang used to be back in the 50s was like the woody, so you think of wood in erections as well, but that it's more about the emotional piece of it. Kidney yang deficiency is a big player. I guess you can say also the penis is a muscle, so the liver could be involved with that as well. But think of the two things: is it any kind of stress, or is it any kind of kidney deficiency? Do you ask? We've already talked about this thing about a person's sex drive. I said, unless if they bring it up, I'll talk to them until the cows come home. But if they don't, I usually can figure out if they have kidney yang deficiency in different ways, or kidney deficiency in different ways. Asking them about, unless instead of asking them if they get it on in the restroom. Not saying that only people that are old have low sex drives. People that are young can have low sex drives, and that can be a whole gambit of hormones or desire. Meaning, like, are you still interested in your partner? We've talked about this earlier. Is there a problem with interest, or is there a problem with interest in your partner, or a problem with interest in sex? The 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 thing that we talked about before. Brad Pitt walked in the room. Would you, if you're a female, would you feel like if you are attracted, if you find Brad Pitt attractive, would you become attracted, or would you not be interested? So if there was like a little bit of that means that there's still the ability to have a sex drive. So it might not be hormonal, so to speak. It might be emotionally based. But anyway, feel free to ask your patients all you want about their sex drive if you feel that's necessary. There's nothing wrong with it. How has your mood been? And this conversational type 10 questions, save this question for last because it usually leads to a discussion about what's really going on with folks. Because a lot of times, oh, sorry, you need to see cameo. Yeah, it's full of the thing for me. But a lot of times emotions are what's going on with people. And you need to be a detective about that to figure out which emotions are going on and treating that system. And I hate to toot my own horn or self promote. That's not what this is about. But I do have a class coming up that I think is super great. That's the CEU class. That's all about how to be an expert with dealing with people's emotions. But you really do need to figure out which branch of emotions, worry, fear, sadness, frustration, which thing is going on to work to figure out which system to treat. And it can be a lot of times it's part of the person's health, but also give them time to talk and make them feel like they're in a safe, private place to talk. Don't do your interview out in the waiting room and talk about all their emotional piece, or like when you see them come in versus like, how is that depression going, Linda? How are you still worrying? Wait to talk about that until you get in the office, okay? Make them feel like they've got a safe place. The people that are seeing you are your patients. They're not cattle. They're people. They're people with needs. Always remember that. So anyway, and that it was already been spoiled, but Cameo, word up. If you guys don't know who Cameo is, which you probably don't, you should YouTube it and look for word up. But it's just saying, hey, this is very important. Word up, key takeaway. The spiritual emotional state is commonly a primary indicator for a person's diagnosis. If you're ever confused, I think the next slide's going to say that. When in doubt, emotion it out. If you don't know what's going on, you ask them about their emotional state, and usually they'll come out and they will tell you what you need to know. They will tell you if they are worried, fearful, frustrated, sad, and that gives you a direction. If you just don't know what direction to go in, that'll help. And this is the thing to ask. This is the thing to ask. You say, in times of duress or high stress, we can all experience a gambit of emotions, a lot of different types of emotions. We can be worried, we can be frustrated, we can be fearful, we can be sad. We can experience all of those, but usually there's one that stands out above the rest. We can experience that mixture, but which one for you seems like it's more prevalent? Think of it like being in a race, and there's like a lot of contenders running, but there's usually one person ahead. Which one is ahead for you? Or the thing that I've been asking or saying recently is, think of the emotions being like flavors of ice cream. Every emotion kind of has its own flavor. You can worry, fear, be stressful, you can be sad. Which and you can go to the ice cream store and get a spoonful of each one of those flavors, right? On a cone. But usually when you're eating that, like which flavor is the strongest for you? Worry, sadness, frustration, fearfulness. And one of the things too, and this is just me, and you don't have to do this, but if I have already kind of think that I figured out, or I will know what they will answer, I'll put that in the middle. I don't put it in the beginning or the end because I don't want to lead them. I don't want to lead their answer. Um, wow, sorry, guys. As with anything, you never want to try to lead the witness, so to speak. You don't want to lead them to go like, "Oh, the last thing I heard was fearful, so fearful. I'm going to repeat that subconsciously." But a lot of times when you start mentioning those, if someone, when you're in the middle of fear, sadness, I'm angry all the time, or you say fear, sadness, frustrated, and before you can get fearful out, they're like, I'm angry, I'm frustrated all the time. If they interrupt you and tell you, I worry all the time, or I'm scared all the time, if they interrupt you before you even finish the sentence, more than likely that's the phase you need to address. More than likely. Nothing's 100% in Chinese medicine, but more than likely, that's what's going to be the phase. So here's some clinical pearls. At the end of the day, this means little valuable tidbits. Always start with your chief. What's your chief complaint? What brings you in today? For a follow-up patient, how is your body today? So let's talk about two. I want to talk about the last one first and then the first one last, because the first one, the very first statement, I just read something the other day, and this is very poignant. But the how is your body today? Sometimes when your patient comes in and you're talking to them and you get chit chatting and they want to tell you about the ways of the world and all of that, to bring them back into focus, you can always say, how is your body today? Instead of saying, how things going? Well, things are going great, but my tractor's broken down and I can't plow my garden up. So that means I won't get my squash in the ground in time. And then I want to be able to make that wonderful squash soup that I always make in the wintertime. And that's going to upset my daughter-in-law because blah, 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 blah. You can see how it can go down the stream. So you can bring them back. It's like, oh, yeah, I get that. But how's your body doing today? And that brings them back to center. So they will tell you what's going on. And then also make sure you have it on your intake form, but you always say, so what brings you in today? So tell me a little bit about it. We talked on the phone about your knee pain, but let's talk about that. What brings you in? Bring them back to their chief complaint. And so you know what you need to treat when you are treating them. And let me give you a really big example. I don't know how I got onto Reddit, but somehow I got onto Reddit. I mean, somehow it got on my phone. So I get these notifications. I don't know why. I guess if I went on there, I probably could figure out. But anyway, I'm too lazy. But I was sitting in between patients and my phone buzzed, and I was like, oh, somebody's texting me. And I looked and it was a Reddit notification. I was like, oh, I got to figure this out. But you know what the Reddit notification said? It was a question somebody had posted, and they said, I went to an acupuncturist, and was what they did appropriate? And I looked and I was like, huh. And I looked, and there was this whole post that somebody put that they said that they went to an acupuncturist. The acupuncturist was not me, because I would have treated them completely different. Um, and they said it was an older acupuncturist. It was a little confusing because I think they had a receptionist and they were trying to ask the receptionist questions, and she's like, only the doctor can answer the question. So she was like, I really couldn't get a lot of answers about things when I got there. She's like, I went in for a hand problem, and she's like, is this normal? He took her pulses. Okay, that's normal. And then she went into this whole thing where he was doing a lot of stretching her legs all over the place. And then she's like, they pulled her pants down a little bit. They had her flipped over and rubbed some kind of mint oil on her back and all this other stuff. She's like, pulled my pants down all the way down so my crack was exposed, which doesn't mean that you're pulling somebody's pants down all the way, but anyway, it didn't sound like she was. And then I don't even know if he worked on her hand. She said he put some needles in my legs and maybe in my wrist, but she's like, I don't even know if he worked on my hand. And that's an example, and we're going to get into this next lecture about interacting with your patients. But she was like, A, I don't know if he was being appropriate, and B, I don't know if he really even treated what I came in for. I came in for hand pain, and he's pulling my pants down and stretching my legs and telling me I got good joints. And it sounded like he was an older practitioner, maybe doing like old school. And when I say old school, it doesn't mean like classical. It doesn't mean that it's, great and mysterious. It was just like probably an older practitioner that was used to just doing general treatments on everyone. And I'm not poo-pooing whatever his technique was, because you can definitely do a lot of Dr. Kahn stuff where you're treating the extremities. You don't treat the area. But she had no idea if he was treating her the right thing or not. And I won't go into it anymore because I'm saving that for the next lecture. But the big thing is make sure you know what you're treating. You're supposed to be treating what your patient is coming in for. If they're coming in for toe fungus, don't treat their lung qi deficiency. Or if you feel like you need to treat their lung qi deficiency, explain to them what you're doing, right? Don't just pull their pants down or stretch your legs and don't treat what they came in for. If a person comes into me for hand pain, I would have treated their hand. I would have twined their hand. Then I would have done some points probably on their hand. Then maybe I would have done some distal points and I would explain to them, I'm doing some of these distal points because in Chinese medicine, they refer up to your hand, right? They have this impact on some of the systems of the hand. So that's why I'm doing these, just so you know. I mean, especially if it's a person if it's the first time they've ever seen you and they don't know anything about acupuncture, don't be pulling their pants down, especially without their permission. Make sure your patient is comfortable. Your patients are people, not cattle. Okay. Um, don't do an intake by reading it like a robot. That's a good one too, especially with when we talked about the 10 questions in less of a conversational format, like the old school, the 1600s, 10 questions. Don't have a piece of paper and be like, do you get hot or cold? Does your head hurt? Do you have foul breath or bowel movements? Don't read them one by one. Make it conversational. Find out what their chief complaint is, and then start thinking about what things could be potentially related to their chief complaint. And let your intake flow from there. Also, in this, as you start practicing more, you'll get a feel for this. But sometimes when you have patients come in, and they do come in for hand pain, right? You have an athlete, they hurt their hand, they want their hand better so they can dribble a basketball to go play back in college sports. They're just coming in for you to work on their hand. They don't give in two cares in the world about their kidney chi deficiency or whatever. So sometimes when I have someone coming in for orthopedic pain, maybe I shorten their intake for them a little bit to just around their primary concern. Then later on, we can start weaving in some other things if need be. But a lot of times, if you do for some patients that, especially if it's not uh, orthopedic, injury, just an injury, I'll do a very comprehensive intake. But if you start doing an extremely long hour and a half intake on someone and they're just coming in because their finger hurts, they're going to get really bored and frustrated with you really quick. So try to weigh out what type of patient you have. Some patients want that really long intake because they have these mysterious conditions that no one else has figured out. So they want you to have spent time with them. But other patients are like, I just wanted you to treat my low back pain, not find out about what my breathing was like when I was a child. So weigh it out. Okay, weigh it out. Let's see. Here's another one. Don't lead the witness. Use open-ended questions. How how are your bowel movements? Do you have daily well-formed bowel movements? Don't bring up the balls, ribbon, or brown banana until after they talk to you about it. Don't lead them into saying, do you have brown bananas every day? Well, of course I have a brown banana every day. And then you'll talk to them more. If you do that, you'll talk to them more and you'll find out that they had a brown banana a month ago. And then the rest of it has been shit. No pun intended. But it's the rest of the time their bowel movements are bad. So don't lead them with specifics. The only time that you have to start leading patients with specifics, or when you get folks that come in and they just grunt. They're like, fine, good, fine. And very rarely are you going to run into that. The only time I ever really run into that is when I'm doing grand rounds and I have patients that come in as volunteers and they don't know what they're in for, and they've just been talked into something that they have no idea what any of this means, and they don't really want to share with the classity of their problems. Those are the only times I really get into specifics, but let them all be open-ended questions. Don't lead the witness. Like I was saying with the emotions, the emotion that I think that's probably going on, I'll throw that in the middle, because I feel like if I lead with it or end with it, it will have some subliminal suggestion that that's what's going on, and people will choose that one. So try not to lead the witness. Even though here's what's funny, even though what happened to your mama's mama's mama might sound interesting, keep focused on where their health is today. I know there's all of these different things in Chinese medicine about karma and how that comes back. Your parents' karma comes back, or your great grandparents' karma comes back and plagues your energy with blah, blah, blah. And, or we get into, my great great grandmother had one leg shorter than the other. So I know that I've been plagued with this, or my grandfather, three people removed, had two hearts and they were on the wrong side of the body. So that's probably why I've got these palpitations. Yeah, or even like sometimes even things that have happened to you, like when I was a child, these my menstrual issues, when I was 13, I used to have these heavy, painful periods. Okay. And then when I became a teenager, late teenager to early 20s, they resolved. Okay. And now what are your menstruation? What are your periods like now? Because it's about what their health is today, not necessarily what their health was 15 years ago. Because everybody changes, their body changes. And sometimes that's important, but keep them focused on really finding out what's your health like today. Because that's who you're treating, is a person in front of you today, not who they were 15 years ago. Yeah, I'm not the person I was 15 years ago. So I'm pretty sure that you're not either. So find out what their health is like today. And here's that other thing about their mama's mama's mama. Let me move this photo, this picture up here a little bit. Even though the government is putting nanotech in our lunch meat, and they're keeping tabs on us, sounds extremely interesting and intriguing. You want to hear more. I had a patient that was coming in talking to me about the hypersonic missiles from China, and she needed to get my physical mailing address, because when those hypersonic missiles hit, then we might not have, our cell phones probably wouldn't work anymore, and she wouldn't be able to contact me to schedule appointments. Well, I think probably if there's a variety of hypersonic missiles that hit from China to here that took out our phone lines, then we'd have more things to worry about than your acupuncture session. But I didn't say that. But that's just giving you an example. Let's just give me an example. When you have somebody that starts going down the rabbit hole about something, bring them back around by, like, here's an example. So tell me which movement causes your shoulder to hurt the most. So tell me again. Yeah, gosh, man, I sure hope those missiles don't hit you. But tell me again what you were talking about with your shoulder. Which movement was it that caused it to hurt? Oh, perfect. Bring them back into the conversation of where their health is today, so you know what to treat. Because if not, this discussion about the government's nanotech is going to go on and on and on, and you're going to look at the clock and you're going to be, man, I don't have time to treat you. And I always treat a person when I interview them. I don't like being like, you just come in for the interview and then next time I treat you. Other people like doing that. Not saying it's wrong. Nothing wrong with that. If that's how you want to treat, that's just not how I treat. So um, try to keep them focused. Try to keep them into the game that you're talking about. We talked about this before. Pain and other conditions like your digestive condition on a 1 to 10 scale. How upset or nauseated is your stomach every day? Bring it back to scales so you can measure their progression, because sometimes for some people, they like seeing a progression. They like to have a notation of their progression. The other thing is sometimes people will give you a laundry list of things, and you're like, what am I supposed to treat? What's going on? That's when you do the magic wand magic. Tell them that acupuncture is not magic, but just say, if we pretend that I had a magic wand and I could wave it over you and fix 3 things, what would those 3 things be? In what order? What's the most important thing for you? So that helps you and them prioritize what they've come here for and what you're trying to treat and what you're trying to fix. So that helps. And then you can start breaking your patterns down. Oh, if you want me to fix your twitching, I need to look at the liver system. If you need me to treat your tummy, I need to look at the stomach. If you've got a headache all the time, where's the headache at? So that helps me know what channels go through there so I can start looking at those. So those are the things. Keep them focused. Speaking of magic, make sure you make very clear to them that acupuncture is not magic. It's just like PT or OT, because we were talking about that before. People understand that a little better, or they can associate that with that. If they've had PT before, they've had to go several times, and usually it's multiple times a week. I only treat people once a week most of the time, except for morning sickness, which sometimes you have to see them a couple of times a week. But acupuncture is not magic. Make that clear to them, because a lot of people will come in if they know nothing about acupuncture and they think one treatment means I'm cured. And that's not how it works. Usually I tell people it depends on what the chronicity is, how long you've had it, and the severity, how bad it is. And those 2 are the factors in the equation of how long it's going to take. Because people always want to know how many treatments it's going to take. I usually say I need to see you 4 to 6 times. Usually I need to see you weekly so we can build momentum. If we try to space it out too far in the beginning, then we will never get a purchase. We never get a hold of what's going on. If you want to only see me once a month, it's going to be very difficult. And I'm just honest with people, because I've had people in the past where they've come in. I had a woman where like her eye was swell. I mean, she had all kinds of crazy stuff. And then she only wanted to see me once a month. And I'm like, I'm never going to be able to fix this. All this adrenal blah 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 blah, alternate eye swelling, like it sounds like something out of the cartoon. Like there was that old movie, The Mask, with was it Jim Carrey in there? Where the eyes are going crazy and stuff. It's like if you do every day, one eye is swelling, back and forth like this, and then you got all these metabolic issues and these kidney fatigue issues. I can't cure anything if you're only going to come once a month. It's not going to work that way. So you need to make sure that they understand it is not magic, and it's going to take a while. Usually I tell them I like to see people 4 to 6 times. And then by that time, I love to see my patients, but I'm hoping by that time I can push them out so I don't see them as frequent. Sometimes you still have to see them, but that frequently, but my goal is to really start pushing people out. So they're seeing me less frequent at the end of that 4 to 6 times. And interestingly enough, I'll give you the timeline of when you're working with somebody. This is why I usually say 4 to 6 times. The first 1 or 2 treatments, they're going to be like, nothing's happening. Nothing's happening. Then about 3 to 4 treatments. If it's a very acute issue, then a lot of times it will resolve. But 3 to 4, they'll start being like, oh, I'm starting to feel something. Things are starting to change a little bit. And then 5 to 6, you're like, well, I need to start pushing this out. No, 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 no. I want to come next week. Let me see you tomorrow. You try to break up with your patients, and it's very funny. I mean, I have the I person going back and forth. Yeah, eventually it was just like this just isn't working. You just want to come so infrequent. We can't get any traction. And I'll be honest with you guys, it bums me out when I can't really help somebody, or when I see that their treatment plan. Very rarely does this happen, but if I see that things aren't working, I will talk to them and say, we'll find a very gracious way of maybe guiding them to someone else. Very rarely is that the case, but if something's not working for people, I am not a person that likes to sell snake oil to people. If it's not working, we need to find a way to make you feel better, to get you better, and then when you try to break up with a patient, then that's when they start bringing you cakes. Like that woman with eyes. I gave her the talk where we're going to have to break up, and I was trying to give her maybe some functional medicine doctors to look at, to maybe get some, or at least get a hormone and blood panel to see if there's something going on or what's going on. And then the day that I'm getting ready to break up with her, she brings me a cake. How do you break up with somebody when they bring you a cake? But anyway, that's just the stories of being in the trenches of an acupuncturist. So here's the things. Here are my things that I find that help me out, and the things that I always ask, and the things that are the most important to me. What's your chief complaint? We just talked about that. Digestion. Their digestive system is our digestive system is so important to how everything else functions. It's not about just, you think about the spleen distributing the energy, transforming and transporting energy and fluids. But in Western medicine, if you're not extracting the nutrients from your food, you're going to be weak and puny. You're not going to feel well. So you need to find out what their digestion level is like. What's your energy level like? Meaning, like, are you fatigued? Are you fatigued when you wake up in the morning? Or do you just get fatigued when it's the end of the day? Sleep. How is your sleep? Do you fall asleep easily? Do you wake up during the night? What time do you wake up? Do you wake up in and out? We've already talked about sleep earlier. Mood. What is your stress level like? Emotionally, what are you like? Do you have any stressors? Because that's going to be a big piece to their health. Women, what's your menstrual cycle like? Are you regular? We've already talked about this. Blood flow, clots, all of it's important. Do you have any musculoskeletal issues? Do you have any pain? Because a lot of times that might be the doorway that brings them in, their pain. So find out. Look at your intake form. You should have a place on there about that. So these are the things. What's your chief complaint? It's important to be treating their toenail fungus if that's what they want, instead of their liver qi or their lung qi deficiency. Digestion. What's your energy level like? Sleep, mood, menstrual cycle, and are there any musculoskeletal issues? So here's an ending thought for you guys. In the end, patient intakes are like a fishing trip. Sometimes you catch fish, sometimes you don't. If you don't catch fish, that doesn't mean there's not any in the pond to catch. Sometimes, and what does that all mean? Sometimes a patient, because they're not comfortable or they don't think about it, they're not forthcoming with everything on their first trip. So every time I see a patient, I spend a little time cycling over things, rehashing things, because things change and new things might come up, or they might forget about telling you things. And maybe the episode 1 of this lecture, when I was talking about, or maybe the last episode, when I was talking about, I was trying to work on that patient with constipation, and it came out in their maybe 3rd or 4th treatment that they were having a lot of kidney yin deficiencies, and that changes the whole picture of things. So always question, because the fish might come to you later. If you miss them in the first session, you'll get them later on. And also, if a person's not comfortable and being forthright about what's going on, don't flog the dead horse. Don't keep beating them. It's like, I know you're worried about something, and you're not saying that you're worried. I know you don't be like that. If they don't want to talk about it, if they don't feel comfortable talking about it, or it's too dark for them to feel comfortable for you to talk, comfortable with you to talk about. Don't flog them over that. Don't flog them. Don't keep beating them. Don't try to beat them into submission to talk to you. It'll come up. If it's important, they'll get comfortable with you, hopefully enough that they'll bring that up. So that's the end, guys. Thanks again for joining me. Hopefully, this is beneficial. Like, subscribe, subscribe to the newsletter, and I look forward to seeing you next. The next lecture that I do, yeah, I'm really excited about is how to interact with patients. And I don't think many people teach this. Many schools don't teach this. And it's not anything magical or mystical, but it's basically 25 years of working with people and how to treat them, how to treat them and how to have a really good session. Because if your patients are comfortable with you or your treatment or what you're doing to them, if they're not comfortable, then your treatment is going to be no good. You're not going to have any success with that. So this is just a really good way of how to think about working with them. But I look forward and I hope to see you soon. Okay, guys, take care.